If you take a blood pressure pill every single morning, whether it's amlodipine, losartan, or lisinopril, let me ask you something important. Do you truly understand what that medication is doing inside your body right now? Not what the label says, not the short instructions printed by the pharmacy. I mean, really understand it. Do you know how it works, what changes it creates in your heart and blood vessels? And more importantly, do you know the warning signs that could tell you something is wrong before it becomes dangerous? Most people don't. I've asked this question to intelligent, careful people who manage their finances, stay informed, and take their health seriously, and almost every time there's a pause. That hesitation reveals something important. Millions of people are taking powerful medications every day while knowing very little about what they should actually be watching for. These are not harmless pills. They are not vitamins or simple supplements. Amlodipine, losartan, and lisinopril are medications that directly affect how your cardiovascular system and kidneys function every hour of every day. Yet many seniors take them almost automatically, never realizing that certain symptoms, lifestyle choices, or everyday decisions can completely change how these medications affect the body. Today, we're going to change that. By the end of this discussion, you'll understand these medications in a completely different way. You'll know what to watch for, what mistakes to avoid, and how to recognize when your body may be trying to send you an important message. To explain why this matters so much, let me tell you about Walter. Walter was 74 years old and had spent most of his life working as an engineer. He was organized, disciplined, and extremely careful with his health. His daughter even set up one of those pill organizers labeled Monday through Sunday, and Walter treated it like an official schedule that could never be missed. Then one day, his doctor added a medication called amlodipine to help improve his blood pressure control. Walter didn't think much of it. In his mind, it was just another blood pressure pill. Different name, same purpose, nothing to worry about. That assumption nearly changed his life. A few months later, he noticed that his shoes were becoming tight. By late afternoon, his feet felt heavy and uncomfortable. Soon, the swelling became so severe that he could no longer fit comfortably into his regular footwear. Walking became difficult. He started limiting his daily activity because moving around made the discomfort worse. Eventually, he became frightened. He convinced himself that his circulation was failing. Then he began searching online and reading about heart failure. His anxiety grew with every passing day, but the real explanation was far simpler. Nobody had ever explained to Walter that not all blood pressure medications work in the same way. Yes, amlodipine, losartan, and lisinopril all lower blood pressure, but that's where their similarities end. Amlodipine belongs to a group called calcium channel blockers. It works by relaxing the muscles inside your arteries, allowing blood to flow more easily and reducing resistance inside the circulatory system. Lisinopril belongs to another category called ACE inhibitors. Instead of acting directly on the blood vessels, it blocks an enzyme that normally causes those vessels to tighten. Losartan belongs to yet another class known as angiotensin receptor blockers, or ARBs. It works on the same blood pressure regulation system as lisinopril, but it affects a different step in the process. Three medications, three different mechanisms, three completely different sets of side effects. And once you understand that, your body suddenly begins making much more sense. Walter's swollen legs weren't caused by heart failure. They weren't a sign that his kidneys were shutting down. In fact, his medication was doing exactly what amlodipine commonly does in many people. Here's what happens. Amlodipine relaxes the small arteries extremely well. Blood enters the lower parts of the body more easily, especially the legs and feet. However, the veins, which are responsible for carrying blood back toward the heart, do not relax to the same degree. This creates an imbalance. More blood is flowing into the tissues than is efficiently flowing back out. Over time, pressure builds in the tiny blood vessels around the ankles and feet. Eventually, some of that fluid leaks into the surrounding tissues. The result? Puffy ankles, deep sock marks, shoes that suddenly feel too tight, legs that feel heavy, swollen, and uncomfortable by the end of the day. This is one of the most misunderstood side effects in blood pressure medicine. Many people immediately assume they are retaining water because they ate too much salt. Others become convinced they are developing heart failure. Some even think their kidneys are failing. In many cases, none of those fears are true. The swelling is simply a predictable response to how amlodipine works. The truly dangerous part is not the swelling itself. It's how people react to it. Some patients become frightened and stop their medication without informing their doctor. Their blood pressure quietly rises again, putting them at risk for stroke and heart problems. Others decide to drink less water because they assume the body is holding on to excess fluid. Unfortunately, dehydration can create entirely new problems. And then there are people like Walter, people who simply suffer in silence. They stop walking as much. They avoid activities they once enjoyed. They become anxious and fearful, believing something terrible is happening, all while the real issue could often be managed with a simple conversation. This is the important lesson. If you develop leg swelling while taking amlodipine, do not ignore it and do not panic. Talk to your doctor. Sometimes adjusting the dose can help. Sometimes changing when you take the medication may improve symptoms. In certain situations, another medication may simply fit your body better. But none of those solutions can happen if nobody knows what you're experiencing. Walter eventually eventually spoke with his physician. The cause was identified, adjustments were made, and within a few weeks, he was comfortably wearing his walking shoes again and enjoying his daily routine. One conversation gave him back his quality of life. And this is exactly why understanding your medication matters so much, because the name printed on that bottle isn't just a label, it's a clue, it's a category. And understanding that category can help you recognize problems early, avoid unnecessary fear, and make safer decisions for your health. But as common as swelling is with amlodipine, there is another side effect from a different blood pressure medication that causes confusion for thousands of people every year. And it often begins with something as simple as a small tickle in the back of the throat. That small tickle may not sound like a big deal, but for some people taking lisinopril, it can slowly turn into one of the most frustrating symptoms imaginable. Unlike the kind of cough you get with a cold, this one is different. It's usually dry, persistent, annoying. It often feels like something is irritating the back of your throat, but no matter how many cough drops you use or how much water you drink, it never fully goes away. It tends to become worse at night, interrupting sleep and leaving people feeling exhausted and confused. What makes this side effect particularly tricky is that it often doesn't appear immediately. Some people develop it after a few weeks. Others may take several months before it begins. By then, most patients never even consider that their blood pressure medication could be responsible. Instead, they blame seasonal allergies, dust, a lingering infection, acid reflux, almost anything except the pill they've been taking every day. This reminds me of Evelyn. Evelyn was 71 years old and absolutely loved gardening. She spent hours outside caring for her flowers and plants. So when she developed a dry cough in late spring, the explanation seemed obvious. Pollen. The timing made perfect sense. She tried antihistamines. She purchased an air purifier for her bedroom. She even changed some of her daily habits, believing something in her environment was causing the irritation. But the cough continued. Weeks turned into months. Her sleep became disrupted almost every night. She was tired during the day, increasingly irritable, and slowly becoming worried that something serious had been missed. Her primary doctor ordered tests. Her chest x-ray looked normal. There were no obvious signs of infection or lung disease, yet the cough remained. By the time she finally came to see me, she had been struggling for nearly a year. One of the first questions I asked her was simple. When did you start taking lisinopril? She paused, then she pulled out her phone and began checking dates. As she looked at the timeline, her expression changed. She had started lisinopril approximately 11 months earlier. The cough had appeared around 4 months after beginning treatment. For nearly a year, she had been trying to solve a problem without ever realizing where it might have started. Once the connection became clear, her doctor switched her from lisinopril to losartan, which works through a similar pathway, but usually does not cause this particular side effect. Within 2 weeks, the cough disappeared. 11 months of discomfort, 11 months of poor sleep, gone in 14 days, simply because someone finally connected the dots. This is why understanding your medications is so important. Sometimes the answer is hiding in plain sight, but there is something even more important that every person taking lisinopril needs to know. Because while the cough is frustrating, another side effect associated with ACE inhibitors is something entirely different. It is a true medical emergency. If you are taking lisinopril and suddenly develop swelling of your lips, tongue, face, or throat, especially if swallowing becomes difficult or breathing starts to feel restricted, do not wait. Do not tell yourself you'll call the doctor tomorrow. Do not simply take an allergy pill and hope it improves. Seek emergency medical attention immediately. This condition is called angioedema. Fortunately, it is uncommon, but when it occurs, it can become dangerous very quickly. The swelling can progress faster than many people expect and may interfere with the airway. This distinction is incredibly important. A dry cough is usually an inconvenience. Swelling involving the lips, tongue, or throat is an emergency. Those two symptoms should never be treated the same way. Remember that difference. It could one day save a life. Now let's shift our attention to losartan, because there is another hidden issue that catches many people completely by surprise. And interestingly, it often happens because people are trying to do something healthy. Losartan works on the body's blood pressure regulation system, just like lisinopril, although it affects the pathway in a slightly different manner. One of the effects of medications in this family is that they can increase potassium levels in the bloodstream. For many people, this never becomes a problem. Regular monitoring usually keeps everything within a safe range. But trouble can begin when certain lifestyle habits unknowingly add even more potassium into the system. Most people think of potassium and immediately picture bananas. But potassium hides in many other places. One of the biggest surprises is salt substitutes. Walk through any grocery store and you'll see products advertised as healthier alternatives to regular salt. Many of these products replace sodium with potassium chloride. And here's where problems can begin. Imagine someone has been told to reduce their salt intake for heart health. They decide to make healthier choices. They buy a low-sodium salt substitute and begin using it generously on every meal. Meanwhile, they're also taking losartan or lisinopril every day. Without realizing it, they're adding extra potassium to a body that may already be holding on to more potassium because of the medication. Over time, potassium levels can rise too high, and elevated potassium can interfere with the electrical system that controls the heart itself. The dangerous part? High potassium doesn't always cause dramatic symptoms. Sometimes it whispers. A person may notice unusual fatigue, muscle weakness, leg cramps, tingling sensations in the hands or feet, occasional fluttering or irregular heartbeats, and sometimes there are almost no symptoms at all until the situation becomes serious. Think about someone you know right now. Maybe it's you, maybe it's a spouse, sibling, or parent. Have they switched to a salt substitute recently? Are they taking losartan or lisinopril? If the answer is yes, that combination deserves a conversation with their doctor. This doesn't mean the medication is bad. It doesn't mean potassium-rich foods are dangerous. It simply means awareness matters, monitoring matters, because many problems can be prevented long before they ever become serious. And salt substitutes aren't the only hidden source. Certain electrolyte powders, sports drinks, meal replacement shakes, and recovery supplements may also contain significant amounts of potassium. Most people never think to mention these products during medical appointments because they don't view them as medications. But from the body's perspective, chemistry is chemistry. Everything counts. Now, there is another situation that deserves much more attention, particularly among older adults. What happens when you get sick? Not a major illness, not a hospitalization, just a stomach virus, several days of vomiting, persistent diarrhea, loss of appetite, a heat wave that leaves you sweating heavily and not drinking enough fluids. These situations may seem ordinary, but they can completely change how blood pressure medications affect the body, because when dehydration enters the picture, the rules change. A dose of losartan or lisinopril that worked perfectly under normal conditions may suddenly become too powerful. Blood pressure can drop lower than expected, dizziness can appear, weakness and faintness may develop, and perhaps most importantly, the kidneys can become much more vulnerable to injury. The medication didn't suddenly become dangerous, your body's environment changed. The same drug is now working under entirely different conditions. This is why every person taking these medications should have a clear plan before illness ever happens. What should you do if you cannot keep food down? What if you are severely dehydrated? Should you continue the medication or temporarily hold it? When should you call your doctor? These are incredibly important questions, yet many patients have never discussed them. And that gap in knowledge can become a serious safety issue, because sometimes the most dangerous problems don't happen because people ignore their health. They happen because nobody ever told them what to do when circumstances suddenly change. And speaking of situations that people often underestimate, there's another common mistake that quietly increases risk for thousands of people every year. It usually begins with something sitting on a pharmacy shelf that seems completely harmless. Picture this for a moment. You've had a difficult week, your knees are aching more than usual. Your back feels stiff every morning. Maybe your arthritis is acting up because of the weather, so you stop by the pharmacy and pick up ibuprofen or naproxen, medications you've used for years without giving them much thought. After all, they're sold over the counter, no prescription required. How dangerous could they possibly be? For someone taking lisinopril or losartan, the answer may surprise you. And if that person is also taking a diuretic, sometimes called a water pill, the situation becomes even more important. This combination can significantly reduce blood flow to the kidneys, especially if dehydration is also present. What makes this so concerning is that it happens in ordinary situations. It doesn't require a major illness or a medical emergency. It can happen during a hot summer week, after a stomach bug, or simply because someone hasn't been drinking enough water. This isn't some rare medical curiosity. It's one of the most common preventable situations doctors see every year. Yet many people never realize the connection. Why? Because over-the-counter medications don't feel like real medications. People often separate them in their minds. Prescription drugs feel serious. Products purchased from a pharmacy shelf feel harmless. But your kidneys don't make that distinction. They only respond to chemistry. And from a biological perspective, those interactions matter. If you regularly take anti-inflammatory medications for arthritis, back pain, joint discomfort, or chronic aches, while also using blood pressure medications like losartan or lisinopril, it is worth discussing safer options with your doctor. In many cases, alternatives exist. Acetaminophen may be appropriate for some people. Topical treatments can sometimes provide relief without the same risks. Physical therapy, stretching programs, or other pain management strategies may also help. The goal is not to suffer in silence, it's to find a safer path. Because in medicine, small decisions made repeatedly often have the biggest long-term consequences. Now let's talk about another symptom that is incredibly common, but almost always underestimated. Dizziness. You've probably experienced it before. You stand up from the couch, or maybe you get out of bed in the morning. For a few seconds, the room feels slightly tilted. You grab the edge of a table or hold onto a wall, then the sensation passes. Most people immediately dismiss it. I just stood up too quickly. I must be tired. It's nothing. But for older adults taking blood pressure medications, that brief moment deserves respect, because sometimes a few seconds is all it takes. A few seconds of dizziness can lead to a fall can lead to a fracture, and a fracture, particularly a hip fracture, can dramatically change an older person's life. Recovery may take months, sometimes years, and unfortunately, some people never fully regain their previous level of independence. This isn't fear-mongering, it's simply the reality of how biology and physics interact. As we age, balance becomes more fragile. Bones become more vulnerable. Recovery becomes becomes more difficult. The dizziness itself often occurs because the medications are doing exactly what they are supposed to do. They lower blood pressure. When you suddenly stand, gravity briefly pulls blood downward before the body has enough time to compensate. For a moment, blood flow to the brain decreases slightly. That temporary drop creates a lightheaded sensation. Fortunately, there are practical ways to reduce the risk. Take your time when getting up. Sit on the edge of the bed for a few moments before standing. Hold on to something stable. Allow your body a few extra seconds to adjust. These small habits may seem insignificant, but they can make a tremendous difference over time. However, occasional dizziness and persistent dizziness are not the same thing. If these episodes happen regularly, continue for weeks after starting a medication, or are accompanied by near fainting episodes, that deserves attention. The medication dose may need adjustment, your hydration habits may need to change. The combination of medications may need to be reviewed. The important message is simple. Do not ignore recurring dizziness. Silence can carry risks. Now let's address another source of unnecessary anxiety that affects countless people who monitor their blood pressure at home. Blood pressure is not a fixed number. Many people imagine it should remain perfectly stable throughout the day, but that's simply not how the human body works. Blood pressure constantly changes. It responds to sleep quality, stress, pain, physical activity, caffeine, hydration, temperature. Even worrying about your blood pressure reading can temporarily raise your blood pressure. Think about that for a moment. The anxiety about the number can actually influence the number itself. This is why a single high reading does not automatically mean your medication has failed. Likewise, one low reading after a hot day or mild dehydration does not necessarily mean your medication is suddenly too strong. What truly matters is the pattern, the trend, consistent measurements over time. Ideally, readings should be taken under similar conditions, the same arm, around the same time each day, after sitting quietly for several minutes, without rushing, without talking, without immediately reacting emotionally to every number that appears on the screen. Unfortunately, many people do exactly the opposite. They see one high reading and become frightened. They take an extra dose, or they skip medication because a single reading looked good. Some call their doctor's office in panic over numbers that, in proper context, are completely ordinary. These reactions often create more problems than they solve. A better approach is surprisingly simple. Track your readings, write them down, look for patterns over weeks rather than minutes. Bring that information to your appointments. Doctors can make far better decisions from a clear trend than from one alarming screenshot sent during a stressful morning. This simple shift changes everything. It reduces anxiety, improves decision making, and helps both patients and doctors work together much more effectively. Now, there's another extremely important principle that many people misunderstand about these medications. Amlodipine, Losartan, and Lisinopril are not rescue medications. They are not designed to work like pain relievers that you take only when symptoms appear. They work through consistency. A steady presence, a predictable effect that builds over time, which means taking extra doses when you're worried or skipping doses because you happen to feel fine can create unnecessary instability. Blood pressure management is often less about dramatic interventions and more about reliable habits repeated day after day. And this brings us to one of the biggest mistakes people make when they start feeling better. They begin to believe they no longer need the medication at all. This happens all the time. A person starts taking blood pressure medication, and after a few months, they begin feeling better. Their headaches are less frequent, they have more energy, their readings look improved, everything seems stable. And then a thought quietly appears. Maybe I don't need this anymore. It's understandable. Human beings naturally connect medication with symptoms. If the symptoms are gone, it feels reasonable to assume the problem has been solved. But high blood pressure often doesn't work that way. One of the reasons hypertension is called a silent condition is because most people don't feel it. It can quietly damage blood vessels, strain the heart, affect the kidneys, and increase the risk of stroke for years without causing obvious symptoms. So when someone feels better while taking medication, it often isn't because the underlying tendency toward high blood pressure has disappeared. It's because the medication is doing its job. Stopping treatment suddenly can allow blood pressure to slowly rise again, often without immediate warning signs. This is why consistency matters so much. Amlodipine, Losartan, and Lisinopril are designed to create steady control, not occasional control. Think of them like maintaining the temperature inside your home. You don't wait until the house becomes freezing before turning the heat on for a few minutes and then immediately shutting it off again. Stability is what creates comfort. The same principle applies here. Large swings in blood pressure place stress on the cardiovascular system. Consistent control is generally far safer than repeatedly moving between periods of treatment and periods without it. This doesn't mean medication can never be adjusted. Sometimes weight loss, dietary improvements, exercise, or other health changes can significantly alter blood pressure needs. But those decisions should be made together with your physician based on patterns and evidence, not simply because you happen to feel well for a few weeks. Another issue that deserves attention is timing. People often ask whether they should take these medications in the morning or at night. The answer is not always identical for everyone. Some individuals tolerate evening dosing better. Others prefer mornings because it fits more naturally into their daily routine. The most important factor is consistency. Taking a medication at different times every day can create unnecessary fluctuations. A pill taken at 7 in the morning one day, then at noon the next day, and late at night after that may not provide the steady coverage that these medications are designed to deliver. Routine often matters more than perfection. Choose a schedule that is realistic. Tie it to a daily habit. Perhaps after brushing your teeth or eating breakfast, simple systems are often the most effective systems, because even the best medication cannot work properly if it is frequently forgotten. This brings us to another important reality, especially for older adults. The more medications a person takes, the more complicated everything becomes. Many seniors are not taking only one medication. They're taking medications for blood pressure, cholesterol, diabetes, arthritis, sleep, acid reflux, or other conditions. Each additional medication increases the possibility of interactions, confusion, and side effects. Sometimes symptoms that appear to be caused by aging are actually related to medication combinations: fatigue, weakness, dizziness, changes in appetite, difficulty concentrating. These symptoms can have many possible causes, and medication should always remain part of the conversation. This is one reason regular medication reviews are so valuable. Bring all of your medications to appointments if possible. Prescription drugs, over-the-counter products, supplements, herbal remedies, electrolyte drinks, everything. Doctors can only identify potential issues if they know the complete picture. You might be surprised how often an overlooked supplement or seemingly harmless product turns out to be an important piece of the puzzle. Another point that deserves attention is hydration. As people get older, the sensation of thirst often becomes less reliable. Many seniors simply do not feel thirsty in the same way they once did. As a result, mild dehydration becomes much more common, and dehydration changes everything. It can intensify dizziness, increase weakness, affect kidney function, influence blood pressure readings, and alter how medications behave inside the body. This becomes particularly important during hot weather. A heat wave that would have been little more than an inconvenience at age 40 may have a very different impact at age 75. Fluid losses add up quickly. Heavy sweating, poor appetite, mild illness, or simply forgetting to drink enough water can gradually create a situation where medications that normally work perfectly suddenly become more difficult for the body to tolerate. This is why paying attention to the body's signals matters. Fatigue that suddenly appears, increasing dizziness, reduced urination, unusual weakness, confusion. These symptoms should never automatically be dismissed as simply getting older. Sometimes they are signs that the body's internal balance has changed, and recognizing those changes early can prevent much larger problems later. Another misunderstanding involves home blood pressure monitors. Many people become frustrated when readings vary from one measurement to another. One reading says 128, 5 minutes later it's 136, then it's 131. This often creates unnecessary worry, but small variations are completely normal. The cardiovascular system is dynamic. It constantly responds to breathing, emotions, body position, recent activity, and countless other influences. What matters is not achieving a perfect number every single time. What matters is identifying the overall trend. Are readings generally improving? Are they remaining consistently elevated? Are there major changes compared with previous weeks? Patterns provide useful information. Single numbers often do not. This perspective can remove an enormous amount of anxiety from home monitoring, because fear itself can sometimes become part of the problem. People become so worried about getting the right reading that they inadvertently increase their own stress levels, which may temporarily raise blood pressure even further. Take a few minutes, sit quietly, breathe normally, allow yourself to relax before measuring. The goal is not perfection. The goal is information, reliable information, and perhaps one of the most important messages in this entire discussion is this: your relationship with these medications should never be passive. Do not simply swallow a pill and hope for the best. Understand what you're taking. Know why you're taking it. Know the common side effects. Know the warning signs that require attention, because knowledge changes outcomes. Walter's quality of life improved because someone recognized that his swollen legs were related to amlodipine. Evelyn's cough disappeared because someone connected it to lisinopril. These were not rare medical mysteries. They were understandable medication effects that became problems only because the connection had not been made. And there is one final area that often receives far less attention than it deserves. It involves communication, because sometimes the biggest danger isn't the medication itself, it's the silence that surrounds it. Silence is far more dangerous than most people realize. Every week, countless people experience symptoms related to their medications and never mention them to anyone. They assume the issue is unimportant. They don't want to bother their doctor. They think the symptom is simply part of getting older, so they stay quiet. They live with swollen legs. They tolerate dizziness. They accept chronic fatigue. They ignore a dry cough that keeps them awake night after night. And little by little, their quality of life begins to shrink. This is something I want you to remember. Good medical care is not simply about prescribing the right medication medication. It's about communication. Your doctor cannot help with a problem they don't know exists, and many side effects that seem frightening are often manageable once they're identified. A dosage adjustment may help. Changing the timing of a medication may improve symptoms. In some cases, switching to another medication in the same general category can make an enormous difference. But none of those solutions happen when people suffer silently. I often tell patients that they are the experts on one thing no physician can fully know: their own body. You know when something feels different. You know when your energy changes. You know when your legs suddenly become heavy, or when getting out of bed becomes more difficult than it used to be. Those observations matter. Never underestimate them, because medicine works best when doctors provide knowledge and patients provide information. It is a partnership, and that partnership becomes especially important as we get older. Our bodies change. Kidney function changes, fluid balance changes, sensitivity to medications changes. A dose that worked perfectly 5 years ago may not feel exactly the same today. This is one reason regular follow-up appointments are so important. Not because something is necessarily wrong, but because health is not static. It evolves, and treatment should evolve with it. Another important issue involves fear. Many people become frightened after hearing about possible side effects. They read something online, hear a story from a friend, or see a television commercial listing potential complications. Suddenly, they become afraid of the very medication that may be protecting them. Fear can lead to dangerous decisions. Some people begin skipping doses, others reduce their medication on their own, some stop treatment entirely. This is rarely the right approach. Every medication carries potential risks, but uncontrolled high blood pressure carries risks too: stroke, heart failure, kidney disease, vision problems, damage that often develops quietly over many years. The goal is not to become afraid of medication. The goal is to become informed. Knowledge removes unnecessary fear. When you understand why swelling occurs with amlodipine, it becomes less frightening. When you understand the difference between a harmless dry cough and emergency throat swelling with lisinopril, you are better prepared. When you know that potassium levels can be influenced by salt substitutes and certain supplements while taking losartan, you become empowered to make safer decisions. Information creates confidence, and confidence leads to better outcomes. Let's also talk about something else that many people overlook: the importance of keeping an updated medication list. This sounds simple, but it can be incredibly valuable. Keep a written list of everything you take: prescription medications, over-the-counter products, vitamins, herbal supplements, electrolyte powders,